Welcome to the Enjoy a Cancer-Free Life podcast with Dr. Ted Koren, best-selling author of Cancer is Natural, So is the Cure. More than care for patients, Dr. Koren transforms lives. He teaches people an all-natural way to heal from and address the causes of cancer using the tools we all have within ourselves. On the podcast, Dr. Koren interviews other thought leaders in natural healing who share insights and information to help you live longer and better.
Okay, here, this is Dr. Ted Koren for our Cancer is Natural, So is the Cure podcast, book on, talking about cancer, chronic illness, and healing. And I have one of my favorite people, Dr. Louis Trovato, who is, he's a unique person. I like his honesty, his background as a holistic biological dentist, to me, is the only true kind of dentistry there is. And I'm proud to know him. Maybe, Dr. Lou, you can tell us a little bit about yourself, where you grew up and your background and what turned you on to this field.
Sure. Well, thank you for having me, by the way. I appreciate that. I've been a local guy forever. I was born in Scranton, but we moved down to right outside of Philly in a little town called Richboro, long time ago, back in the late 50s. I went to dental school. Got out at about, 82, and pretty much was nose to the grindstone for about 10 years, just doing dentistry the way I was taught and not thinking twice about it. And lo and behold, about 10, maybe 12 years into my career, I started to have some health issues, and they were just oddball things that nobody really seemed to be able to put a finger on, and they just got worse and a little worse. And going to my my primary care, he would take blood and he would say, "Oh, you're a little anemic, take some iron." And I'd sit there looking at him like, "Doc, I feel like I'm dying here, and you're telling me just take some iron, that's all you got?" And as a result, I had to do some of my own research, and I had an old blood chemistry book that I had from an old mentor, and I went through my blood chemistry, and lo and behold, it became pretty obvious to me that I was heavy metal toxic, namely mercury. And when I realized that, everything changed. And I had to find somebody who could help me with that because, at the time, 20 years ago, basically, there weren't a lot of people that were around here that would, were delving into the heavy metals and detox and things of that nature. But I was
find out, apart from your clinical symptoms, did you have any tests done?
Well, eventually, when I got to somebody who understood it, yeah, we did a chelation test. We took some DMSA, and I collected my urine, and we sent it into doctor's data. And lo and behold, I had lead and mercury off the scale, basically. I'm not sure where the lead came from. I'm positive where the mercury came from. I mean, that was my profession. But, not a lot of people understand the synergy between lead and mercury. It's pretty deadly. And, the consequences was, we really had to start to do some major detoxification. And, I joke about it now, but I was probably in my mid 40s, and I'm 64 right now. And I honestly can say that I feel better today than I did 20 years ago. And, it was a life-changing event because realistically, once I realized that mercury was my problem, we couldn't in good faith go back and practice the way we did, which was just walking in, drilling mercury fillings out with no barrier techniques. And I went and I sought out the powers that be, namely the IAOMT, which is the group that taught me how to safely remove mercury. And we implemented all the safety precautions. I refer to it as safe amalgam removals in the practice. And things changed, and it's kind of hard to describe it, but once we started to do it, it was really for my protection and in theory my staff's protection. But we started to get phone calls, and wellness centers were calling me because my patients were talking about it. And I think one of the biggest fear from general dentistry and general dentists in general is that patients are not going to how can I put it? They're not going to accept this. They're going to feel that this is over the top. And it was quite the exact opposite. My patients loved it. I mean, when you really think about it, if you say to somebody, "Listen, there's two ways I can drill this mercury filling out. I can do it unsafely, and you're going to get a big douse of mercury, or I can protect you. Which one would you like to do? And I think most normal people would say, yeah, please protect me. So, you know, when we started to get phone calls, we started to get busy, and you know, we were getting referrals, and you know, one thing again led to another, and now we're a completely referral based practice. I don't do any marketing. You know, we don't, you know, solicit patients from anywhere really. And every patient that I get is pretty much referred to me by either a family member or a wellness center or a practitioner that we work with. And it's been, you know, it's been quite the life-changing event. So I guess sometimes bad things happen to people and good things come out of it. And, you know, that's pretty much my story.
Well, you know, it's funny, but almost every holistic dentist I know has a tragedy of some kind.
Exactly.
Or some kind of challenge.
Yeah.
I remember you had told me something. I don't know if you want to talk about it.
What's
You
that?
said that you had a home office at the time, and that you were using the mercury and then going into your kitchen right next door.
Yeah. Yeah. I mean, you know, we're not taught this stuff in dental school. That you have to seek this information out. And quite frankly, you know, when you start to bring these things up, and I mean, it becomes quite a, I don't know what the word would be, but you know, the powers that be don't like to talk about mercury. It's just one of those touchy subjects in dentistry. And when you start to, you really get vocal about this, the powers that be can get, you know, it's sticking a stick in a beehive sometimes. So you have to be careful. You know, you have to be careful what you say and what you say about it. But you know, mercury is a very intimate subject to me because I lived it. I've gone through it. And if I have a colleague who poo-poos it or says it's a bunch of nonsense, you know, my feathers get a little riled up. And, you know, a good friend of mine said, you know, you don't want to see angry Lou. That's not a good thing. And so, you know, I take the good with the bad with this, and I don't try to convince anybody of anything. You know, we do what we do, and our patients come to us because of what we do. And, you know, like I tell every new patient, it's not my job to convince you. You know, my job is to give you information. Your job is to figure out what you want to do about it. And that's how we handle every single patient that walks in the office. So if they're, you know, on board with this, we continue treatment. And if they don't have a clue, I tell them to go home and learn about it. And we'll always be there for them, and they can come back when they're ready.
That's probably the best thing a person can do as a practitioner, respect where the patient is.
Exactly.
And sometimes you just have to nod and say, okay.
Yeah.
You have
Again,
to,
you know, trying to convince people, again, I joke a lot about this stuff with colleagues, but you know, it's like trying to convince somebody to change their religion. I mean, there are paradigms that people have, and they're convinced that they're right. And you know, it's a losing battle. So you know, we try to keep like minds, and we try to keep people in the practice who you know, agree with our philosophies, and you know, we try to help them as best we can.
I was first exposed, I guess is the word, to dentistry from the mercury angle.
Mhm.
I had a whole mouthful of mercury growing up. Dr. Glick on Church Avenue in Brooklyn. I
There you
remember.
go.
Right just across the street. Why I was having so many cavities, nobody even explained.
Mhm.
But he would, of course, fill it with mercury. I still remember that scraping kind of sound as
Yeah.
you would dig
Yeah,
in.
you're not alone. That's for sure. You're not alone.
No, unfortunately.
Yeah.
But later on, when I started looking at the subject of chronic illness, I realized that mercury from dentistry was one aspect, but there's also the focal infection theory, root canals
Mhm.
and cavitations and all. Would you mind talking about them?
Well, you know, dentistry, I call it the dental component of health. And people have to understand that it's a very multifactorial issue. You know, heavy metals is one component, mercury being the main heavy metal in dentistry, but we have all kinds of metals in dentistry, nickel, titanium, cadmium, gold. You know, and again, you know, that's just one component. You can, from that whole metal thing, we have a whole issue that we run into called oral galvanism. Oral galvanism is basically when you have dissimilar metals in an acidic environment, which most people's saliva is slightly acidic, you create a battery. Now you have all this energy in your mouth. You know, again, I joke about, you know, you're probably old enough to remember Uncle Fester on
Oh,
Adam's
yeah.
Family,
Oh,
you know,
sure,
with the
sure.
light bulb. But there are some people with so much energy, and we measure this in people's mouths with a little instrument called a potentiometer. But then you get into kind of the infective side of things, and this is where things get a little dangerous, in my opinion. You know, dentistry accepts pretty much across the board gum disease and gum infections and the systemic effect of that. You know, gum problems and gum issues are not local. They're full body effect. The same concept really follows suit with root canals and infected root canals. They're not local, they're systemic. And then we have another problem of what we call cavitations, which are basically infected areas of the bone where teeth were extracted poorly and the infection wasn't completely cleaned out. That's not local, that's systemic. We have tonsil infections that become infected and become systemic. So, you know, root canals, again, it's a very touchy subject in dentistry. Um, Millions and millions of root canals are done every year, and again, when we're our paradigm is saving everything. You know, that was one of the things in dentistry that I always remember in dental school. We had to save everything. That was our goal, keep everybody's teeth. And what I found through my research and through my learning with a lot of amazing gurus is that sometimes teeth aren't worth it, you know. And when you start looking at the systemic nature of an infection from an old root canal, and probably about 70% of root canals will reinfect at some point because it's a flawed procedure. That's the problem with root canal. It's almost impossible to clean every nook and cranny of that tooth out. And if you leave any necrotic tissue in there, it's going to reinfect. The only thing that's going to save you is your immune system. And if you're healthy, you can buy time with these things, but there comes a point in everybody's life where your immune system gets overwhelmed, and now these teeth start to become a problem. Now, that's the physical side of it, you know, and nobody talks about it, and I can guarantee you this is not taught in dental school, but there's also an energetic side to this where every tooth in your head is associated with a meridian system. And when you do a root canal, you basically shut that meridian off. It's like a scar. And if you understand acupuncture and scars, they're blockages. So, you know, if God forbid we have a man come in that's dealing with prostate issues, and they have a root canal on the prostate meridian, well, you know, you got to think twice about whether you want to keep that tooth in your head. The worst for me is stomach meridian. And we get women coming in all the time with breast issues and God forbid breast cancer. And the stomach meridian is the breast meridian. And if there's a root canal on there, we have to have a long discussion about whether it's appropriate or, you know, even smart to even keep that tooth in your head. So there's an infection side, a physical side, and an energetic side of root canals. And it's such a complicated subject that, you know, you really have to understand it and you have to buy into it. You know, again, I can't convince anybody that that's the case. They have to do their research, and there's plenty of stuff out there. I mean, there's a lot of really good books from Dr. Huggins to Dr. Levy. He just wrote a great book called The Hidden Epidemic, which is all about root canals. And I highly, highly suggest anybody who wants to understand this, get that book, because he took it into the 21st century. You know, Dr. Huggins did a lot of research on this with Dr. Price's work. And, you know, that was back in the 60s and the 70s. Dr. Levy took all that information and brought it into the 20th century and started talking about cone beams. We can get into that if you like. And, you know, there's a lot of information out there now showing that root canals may not be the best way to go.
Well,
so that's kind of the direction.
Oh, sorry. Didn't this will say that every cancer patient had between 8 and 10 dead teeth, meaning root canal teeth?
Yeah, and then that's another issue because, you know, a dead tooth and a root canal tooth are two different things. You can have a dead tooth without a root canal, and it still could be you know, it could still manifest into systemic issues. So that's where the cone beams shine, you know, because what it is, our regular x-rays are two-dimensional. You know, we just take a picture and we look at it as a spot in time from one position. Now, the cone beam becomes a three-dimensional x-ray where, you know, I can manipulate this film and turn it in 360 degrees, look at it top, front, side, back, and we see things on that x-ray that you'll never see on a regular x-ray. So that's becoming standard of care realistically in my world anyway. I don't know about general dentistry, but I think most holistic dentists, if they don't utilize a cone beam, they're missing the boat because they're missing a lot of infection.
So I had read that 8 teeth correspond to the breast in the terms of the meridian.
Yeah. The 4 upper molars and the 4 lower premolars are all stomach meridian, breast meridian. Yeah.
Well, however, there's also wisdom teeth extractions.
Right.
When I first got into the whole idea of nutrition, when I remember I was wondering, my Lord, my parents didn't have their wisdom teeth taken. My grandparents did. They certainly hadn't, going back generations. Suddenly everybody needs their wisdom teeth removed.
Yeah, and again, that's I guess it's a judgment call that everybody has to make. I think there's a couple things that play into wisdom teeth. I think personally that evolutionary wise, we're not as, our jaws are not as big as they used to be. You know, when you look at some of the stuff that Weston Price did, and you look at some of the smiles on some of these indigenous people, I mean, they're just,
Photos.
it's like a Da Vinci, yeah, it's like a Da Vinci painting. It just goes on forever. And you know, they have plenty of room for 32 teeth. But now when you start to get into some of the kids that are nutritionally compromised and are dealing with allergies and food allergies in particular, and they start to narrow their arches, now all of a sudden you don't have room for 32 teeth. So those wisdom teeth get caught. And when they get caught on an angle, or they come in, you know, on awkward positions, if you just ignore them and let them go, there comes a point in time where it becomes incredibly painful when they try to come through. So a lot of doctors will just elect, because of the nature of the x-ray, and you see the position of the tooth, and you make a logical decision that I'd rather get this out prior to a patient having pain with it. Where the problem lies with wisdom teeth and the eventual cavitations is that some of these teeth are so difficult to get out that most of the surgeons are so happy just to get the darn thing out that they don't go back in there and clean out the ligament and clean out the bone. And if you don't do that, you're leaving the membrane, basically the tooth ligament is the membrane that separates a tooth from the bone. And if the membrane's left in there, the body doesn't realize the tooth is gone. So it will heal over, but leave a hole. And if you follow Dr. Klinghardt or some of his teachings, he will tell you that the lower jawbone is the dumping ground for all your heavy metals and all your toxins. It's a perfect place to sequester these things. And when they build up sufficiently in these little holes, we call them cavitations, and they have to be surgically opened up and removed. And that's a lot of the stuff that Dr. Voles and some of the people in Switzerland do on an everyday basis with all the patients that walk in that are coming to them because they're sick. And it's another component. You know, we talked about all the different components with heavy metals, but this is just one of the components. That's what makes dentistry so complicated and sometimes scary, you know.
I always recommend that anyone with any kind of chronic illness, especially weird things you can't figure out, in addition to cancer, Alzheimer's, what have you, is to go to a holistic dentist and get a proper analysis, a Panex and a cone beam to get into the area.
You have to, because if you're not getting answers from your doctors and they're all shrugging their shoulders and going, I don't know what's wrong with you, chances are you missed it and it's in your mouth. That's what's going on. And there's not a lot of practitioners out there who are trained to open somebody's mouth and take a tongue depressor or a mirror and actually look, you know. I mean, it's not a hard thing to do. And most people know that they have a root canal. Most people know that they have mercury in their head, or at least silver fillings, which obviously is a misnomer. It's a mercury filling.
And they certainly know if their wisdom teeth were taken out.
Exactly. So these are simple questions you can ask someone as a practitioner, non-dental practitioner, and find out if maybe you have a dental component. Now, the problem comes in that in the United States, dentistry is probably not the first subject you want to bring up as a practitioner, especially a healthcare practitioner who deals with detoxification or some other things that go on, because it's a scary thing. Not many people like going to the dentist. And if your first day on with a brand new patient in your chair, you say, you should have those 8 root canals removed and 8 implants put, I mean, you're going to lose the patient. So you have to work that in. And I think, from my perspective and from my dealings with most of the wellness centers, patients understand when they hit that wall. When they've done everything right and they eat well and they supplement well and they exercise and they're sleeping and they're doing all the things they should do and they're not getting better, they reach that frustration point where they go, you know what, maybe I better go deal with my teeth. And that's the point in time where everybody just shows up, and my job is easy at that point because they sit in my chair and they tell me what they want, and I go, okay, and that's pretty much I don't sell dentistry, that's for darn sure. And it's just one of those things that they know what they want. They're very, very well educated from their process, and it's easy for us.
when I first started doing KST and asking the body, what does it
Hmm.
want? You know, I was trained as a chiropractor and I would always look at the spine. Suddenly
Right.
the body, the feedback is sending me to the teeth
Yeah.
or to the cranial bones
Yeah.
or what have you.
Yeah.
So I remember one of my first patients, it's like the universe always sends you the most interesting cases right away.
Absolutely.
So I remember she was in her mid 40s and she had breast cancer.
Mhm.
And she says, I don't understand it. I eat so well. I take such good care of myself. How could I have it? And I checked her and I found a tooth that
Mhm.
was, I said, what's here? She said, a root canal. I said, well, it's infected. And it's on the same side as the breast that had
Of
the
course.
cancer,
Yeah.
which I'm told is the case in about 95% of
It's
95.
it's well documented. It really is. It's not something that's made up. It's not, there are lots of research on root canals and their manifestations in the body. Let's put it that way.
So I remember telling her this, and she went to a local holistic dentist, and he called me up. He says that was the one tooth in our whole body. He did a panoramic X-ray. He
Hmm.
said that was the one tooth that had a severe problem. He said it's
Hmm.
really badly infected. He said,
Sure.
what do you recommend? He said immediate extraction.
Yeah.
So a couple of weeks later, she comes back to my office and says that she went to her dentist who put the root canal in, who did
Hmm.
the root canal. He said it was fine.
Yeah. Of course. Yeah.
And she died about 4 months later.
Yeah. It's unfortunate, and we see that all the time. And I think, from an allopathic dental approach, you can look at any root canal and make a play for why it's okay. And from an alternative approach, you can look at any root canal and make a play for it's not okay. And that's my world where I live. I don't think any root canals are okay. When you listen to the Germans and the Swiss, root canals are the scourge of the earth and the root of all evil. So there really aren't any good root canals. You can say, well, it's very well done. And you can look at an x-ray and say, it's a beautiful root canal and it looks awesome on an x-ray, but there's still an energetic component to this that doesn't ever go away. That's still a scar. And whether physically it's okay, energetically it's never okay. And that's the problem I think people run into. And for, you know, the normal patient load, wrapping your brain around acupuncture and energy is much harder to do than a physical problem like an abscess. That hurts. You walk in, you have pain, you say fix me, you take the tooth out and everybody's happy. But when you say you have an energetic disturbance, not many people understand that, let alone would use it as a reason to extract the tooth. So that's the hard part from our side. We have to educate people and
Yeah,
have them read.
is there a good objective way of determining it? I mean, I asked the body, and it's
Absolutely.
called the occipital drop, but
Yeah,
muscle testing is more entertaining, and you can see it. It's more
sure.
objective. But even
Absolutely.
that doesn't show you the energetic, uh, you know, the amount of energy that's blocked.
Right.
Are there any instruments that are being?
Well, I mean, you have things like EAV. That's certainly something that could see this.
Can you explain what that is?
Well, EAV is electroacupuncture according to Vols, and it's an electrical device that you put on acupuncture points, and it will tell you whether the acupuncture point is functioning properly or not. And there's a couple points on the hand that will manifest from the mouth, and you can use these points as a guide to whether or not we've got a dental problem. And it gets much more specific than that. I'm certainly not an expert in EAV, but I've seen people use EAV as a technique, just like I've seen people use muscle testing as a technique, as you use occipital drop as a technique. But these are things, again, Ted, and I think you can appreciate it more than anybody, that you have to have a basic understanding of this, or you're going to look at it like it's voodoo. I mean, when somebody does a
Right.
muscle test, you've got to have a practitioner who's got some integrity, that is not using the muscle test because he has a couple expiring supplements he wants to sell. So that's a problem that we see, and it's just one of those things that when you have a doctor with integrity or a practitioner with integrity and you trust them, it works beautifully. And that's where I trust muscle testing intimately, because most of my practitioners are, well, that's why we work with them, because they're honest, and then that's critical.
Yeah, this is a form of healing, the occipital drop muscle testing. I call it a binary biofeedback device,
Okay.
in which binary yes, no,
Hmm.
biofeedback, you're getting information from the
Sure.
person's body. But there's also a consciousness quality to it.
No doubt.
And the doctor has to be open about it. The
Yeah.
patient has to be at least not fighting you
Right.
and just keeping an open mind on it.
Yeah. Yeah.
And this is an area of healing, the consciousness aspect, which I think is the new aspect of healthcare.
Hmm.
And of course, consciousness, energy, information, they're all interrelated to a
Sure.
great degree.
Sure.
When you talk, I guess in martial arts, they tell you to concentrate your energy in an area and
Hmm.
you can put your hand through a wall or whatever.
Yeah. Yeah.
There's something to it. When people have chronic illness,
Hmm.
cancer, heart disease, what have
Hmm.
you, do you, I know by law you can't say, I'm going to treat your cancer or anything like
Never.
that,
Yeah.
but you can let them know that this will help their entire body. It'll help them detox, it'll help their entire body function
How,
better.
how I explain it is very simple. The dental component is a boulder, and you have to move that boulder in order to continue down the road of health. All your practitioners up to this point have hit this wall, this boulder, and my job is to get that boulder out of the way. And that's going to include getting all the mercury out of your head, getting the bad root canals out of your head, and we can go on and on about this, making sure the periodontal disease is okay. There's no cavitations, your tonsils are functioning properly. But there's structural components too that can inhibit healing, vertical dimension, TMJ. These are things that, upregulate people's sympathetic nervous system. And you know that if you're upregulated sympathetically, you're not going to heal, because you're eliciting cortisol, and you're just not going to be able to create a healing event. And again, when you get people on a level playing field with their mouth, um, now practitioners have the ability to finish what they started and continue on with the detox and structurally get people stable. I mean, we've talked about this. I studied years ago with a gentleman who was a chiropractor named Bob Walker, and Dr. Walker, he taught a course called chirodontics, which was fascinating to me because as a chiropractor, he taught me more about dentistry than any dentist I've ever learned with. And when I started to realize the relationships between chirodontics or chiropractic and dentistry, things started to really happen in my practice and getting people's bite right. Just as simple as getting their neurology right, in the head, allowed things to happen and heal. And it's amazing, but that's how complicated dentistry can get, because you can take it as a basic level of just, well, let's get all the metals out, or let's clean up the galvanism, or let's, make sure the gums are healthy. But you can get into so much more. And this is all about how much a dentist really wants to dive down the rabbit hole. And, a lot of my colleagues aren't willing to do that because it's scary, so, um, I used to joke, the more I learn, the less I understand, and that's part of the
Yeah.
problem.
One of the things I've always admired about you is you're always going to seminars.
Well, I find that, when I open a door and I enter a seminar, there's usually three doors in front of me that I can open, and the door behind me slams shut. So you can't unknow what you know, and you got to keep going up that direction. And I've always found it fascinating. Every time I go and I take a course, I learn something, and I'm usually able to incorporate it and bring it to the practice, and it's been beneficial forever, and I don't think I'll ever stop learning. Even when I stop practicing, I'll continue to learn, because there's always somebody out there that can teach me something. And that's, I think, a component of at least my being, that I always want to learn, and there's not everybody out there that feels that way, unfortunately.
And they certainly don't teach a lot of this stuff in dental school.
No, no. I mean, this is all extracurricular, and you have to take you have to have the right mentors and the right guidance. And I was very fortunate to meet some really, really good people early on in my career who guided me down this road, and introduced me to mentors that have been just amazing helps to me. And, maybe the direction I went and how I did it might be different than others, but there are people out there who are just giants in this alternative medical and dental field. And they're the people you have to seek out, without a doubt.
You inspired me to ask about Thomas Levy, if he'll be interested in doing a podcast.
Dr. Levy is an amazing resource. I mean, he's just one of those guys. He's a lawyer, he's a doctor, and when he talks about that, I think anytime a medical doctor talks about dentistry, you have to take note. You have to understand that this is not their field, and they're so passionate about how dentistry plays into medicine that you have to just you have to acknowledge that. And Dr. Levy does a great job, and he learned all that he knows from Dr. Huggins, and Dr. Hal Huggins learned all that he knows from Dr. Price. So this is not new information. Dr. Price was writing about this back in the 20s and 30s. So this is all regurgitated stuff, but it's just one of those situations that not everybody wants to hear it. And that's the thing.
I especially like your comfortable, matter-of-fact way of teaching.
Well, again, I've gotten to the point where I know that I can't convince everybody, and it's not my job. I just give them information and let them make decisions. It's the easiest way to treat. It's the easiest way to practice. And when you're not constantly hounding somebody, and you just say, "Here's the information. What do you want to do about it?" People respond to that. They really do. Because you're not trying to sell anything.
We were going to have our seminar in Philadelphia,
Yes,
and you were one of our guest speakers, and of course that didn't happen.
Yeah, looking forward to doing it again, though.
Oh yeah, you'd be wonderful, I'm sure. Thank you. We're about out of time. If people want to get to know more about you and connect with you, how could they do that?
Well, the easiest thing is our website. We have a really great website. It has a lot of this information on there, a lot of resources, a lot of links. It's meetinghousedental.com. Is that right? Yep. www.meetinghousedental.com. And, that's the easiest way to find out about what we do. And, if there are any questions you have, there's plenty of links on there to find out about it. And if we can't answer it on the website, you can throw a question out, and, somebody will answer you. That's for sure.
Well, holistic biological dentists are few and far between, and I think we're so lucky to have you in the area. I'm just shocked that
well, we try to keep a low profile. We don't like to throw this out there, but the few of us that are around here try to do the best we can with the resources that we have. And I wish more dentists would love to learn about this and jump on board, but we don't always hear that. What's interesting, just to finish up, is I've been getting phone calls about a lot of our barrier techniques and a lot of the things that we've done forever with mercury. Now that we've got this, this virus to deal with. So it's been interesting to see how dentists are now starting to, pick up on some of the vacuum systems and some of the safety protocols that we've had for 15 years, so.
So maybe there's a silver lining to all this area. Maybe. Thank you, Dr. Trovato. Let me stop the recording at the moment.
You got it. Thank you, Doctor.
Do you need money to fund your idea, product, or service? Are you ready to take your business to the next level but need capital to get it done? Kevin Harrington has heard more than 50,000 pitches and knows how to help you make the perfect pitch to get the funding for your entrepreneurial dream. He's distilled the process down in his perfect pitch cheat sheet, and it's yours for free. Just text PITCH to him right now at 727-888-2100. Text PITCH to 727-888-2100 right now and claim your free perfect pitch cheat sheet. Text PITCH to 727-888-2100 to start funding your dream today.
This show has been produced by Market Domination, LLC. To discover how you can have your own show completely done for you and turn it into a real published book and become the authority in your marketplace, go to www.marketdominationllc.com/podcast offer.